Very good evening to all of you. Good evening, everyone. So it's indeed my pleasure to be here to talk to you, the students, and we have eminent faculty with us, Dr. Rajiv Dhawan, who is definitely the most loved faculty in India and across the globe. Sir, a warm good evening from my side.
Thank you. Thank you very much, ma'am. Thanks a lot.
So today, as your NEET PG 2024 counseling is just ahead, so we here are today to discuss about the prospects in two branches, India and one across the globe, ophthalmology and ENT. So we are here to guide you about these two surgical branches. How's the prospect of this in the residency? What are the career options after that? How is the life settlement after that? How about the residency? How are things there? So guys, if you have any questions, any queries related to these two surgical fields, you can write to us. So we are here to guide you. We are here to answer your queries. But I'm sure those who are watching us live today, they are not amongst the rankers, I'm sure. The rankers generally do not sort for these two branches as, rankers probably aim more for either medicine, surgery, radiology, dermatology, because these branches are also, rank determined. But ENT and surgery are usually taken up by people who have not got very good ranks in NEET PG exam, or mostly, sir, I have seen that my colleagues, my, juniors, some of my juniors, they have taken ophthalmology even after getting very good ranks because their parents are ophthalmologists and they have a very good setup. They are leading ophthalmologist, and the child is born the day his destiny is, determined that he is going to be
Okay.
handled the hospital, he is going to be ophthalmologist. So all, a full stop to every question in his life. So I
Yeah.
have seen some very, very good students who have got amazing ranks in NEET PG and All India and AIMS exam, and they just go for ophthalmology because, they have a very well established center. So this is my perspective about the branch, that generally rankers, very good rankers, they do not prefer this branch. But being an ophthalmologist now, I can tell you, bacha, that it's a lovely branch to be in. So today, me and Dr. Dhawan will elaborate about our subject. And before you write your queries, I would have a question from you, sir. Sir, how ENT happened to you? I have heard that you've got a very good right. So
Yeah.
how
Yeah.
ENT came to you, sir? Everyone would
Uh,
be
yeah.
interested in knowing,
Yeah.
including
Sure. Sure. Thank you, Shivani, for wonderful brief. But let us keep this session. We would be keeping the session absolutely informative, and it should be useful for you because this is a critical juncture you are passing. And if I can tell you, this is the most crucial decision of your life you'll be taking. It is a marriage in which divorce is not possible. Unfortunately, fortunately, whatever it is, you have to live with this branch. So, whichever branch you choose, please choose carefully. Now, a couple of things like what Shivani asked actually, how ENT happened actually. My rank was below 500 Shivani in All India PG. So I was getting almost every branch, like you can say radiology, orthopedics, medicine, surgery, and whatever. And people were like telling me that you're crazy or what, man? Who takes ENT at this rank actually? Because leaving these core very high demand specialties and jumping into ENT arena actually is not really sane actually. If somebody looks from a distance, but you know what? We are genetically programmed to do certain things actually. And if you have the
right.
privilege, you can choose that. But whatever rank you have, please try to bargain it well. Keep three branches in your mind. And regarding ENT, I'll definitely tell you. But before I tell you about ENT, I want to tell you if you are clear about three branches. Like I was clear that I want to do ENT, ophthalmology, or psychiatry. These are three branches in my mind at that time, and you should have three branches in your mind. That's how you should be, and don't feel that saturation issue. This is what actually the problem I feel, and I want to address that question once and for all, guys. इंडिया जैसे कंट्री में saturation की बात ना ही करें तो अच्छा
कोई नहीं
है. Every
सीखता।
sixth human on the planet is Indian. If you are New Zealander, if you're Kiwi and you work in New Zealand, I can understand that which branch you should take. Only 55 lakh people are there. You know what? Like in India, every sixth human being is Indian. 55 lakh people are nothing but these many people take यूपी में कुंभ के मेले में एक दिन में नहा के चले जाते थे लोग. हम क्या बात कर रहे हैं? नंबर्स हमारा सबसे बड़ा वो है. इसलिए आप इस बात को दिमाग से निकाल दो दैट दैट यू नो ओ नो डॉक्टर धवन, सैचुरेशन सैचुरेशन किस एंगल से है ये मैं बताऊंगा। जो ईएनटी की बात करते हैं कि ईएनटी मेरे को क्यों पसंद है, ईएनटी में कुछ चीजें हैं, प्रोस और कॉन दोनों की बात करेंगे। प्रोस मैडम ये है कि एक तो बहुत ही अल्ट्रा स्पेशलाइज्ड ब्रांच है, और मेरा कोई मन नहीं था कि मुझे बाद में एमसीएच या डीएम करना है। मुझे था कि बस हर बंदा
Right.
अपने तरीके से सोचता है, और मुझे लाइफ जीनी थी कि मेरे मेरे को नहीं करना भाई, ये रैट रेस का पार्ट नहीं बनना। आई वॉन्ट टू डू अ स्पेशलाइज्ड ब्रांच। Number two, I'm not into gross surgical work. I think I could understand I'm better off in the microscopic works, endoscopic work. And that actually I was like more comfortable imagining myself doing. And everybody gets an idea if you're a surgeon that which way you want. Like orthopedician know their orthopedician only. Jod ke
Right.
todna and all that, you know. So in ENT, there's a big blend of OPD practice with procedures in the OPD and with the diagnostics being done in the OPD itself, and then the variety of surgeries we have. Now, before I start selling ENT to you, I must tell you, disclaimer is we are neither me nor Shivani want to sell this branch to you. We want to open our mind that today, if we are standing, 20 years post this thing, where are we actually? The cons, let me tell you. If you apply for residency, senior residency, if you did from a good medical college, maybe like you're from like Southern Medical College or MEMC or LHMC or some good medical college like maybe Mumbai or wherever, immediately getting SR-ship is becoming one of the assessment tools for all everyone to say, is this saturation or not a saturation? Let me tell you already, there will be waiting period for SR-ship. But is SR-ship the only route after PG? I think we are smart enough now. There are many fellowships are there. If you are not hell-bent for a government job, then doing an SR-ship in a government hospital is not the only scenario. It's not a bad scenario, but we have got a lot of fellowships over there. But yes, if that's the criteria to ask for, कि sir saturation है, एक सीट आती है, 12 लोग अप्लाई करते हैं, और फिर कॉलेज के बंदे को प्रेफरेंस मिल जाता है, I think I would agree. मतलब मैं उसमें बिल्कुल भी I will not let to contaminate that thought because that is a fact actually talking about.
That
But
is a
when we
fact.
jump in, yeah, when we jump in the market, ma'am, when we are like having training and all that, okay, you did SR-ship also. Now the next question people say, Dr. Dhawan, ENT cases are eaten by or handled by GPs, MD medicine, or pediatricians and all that. Do not worry, we also handle their cases now. Why? It's a crisscross. Why to really, have a negative picture? If your fellow people are earning out of that or making good, things, it's okay. Some cases will come to you also. Don't worry. Every cold is not really seen by the, like 2 time, 3 time cold. People say no, let's show to ENT. मुझे बार-बार जुकाम हो रहा. Like मेरे ear में irritation हो रहा है. Variety of problem in this, in this cassette is so heavy that the volume of the cases is never going to be less. Only thing is, I would suggest to you that if you have a passion about the branch, a little bit, little bit honesty and integrity in the practice you are doing. You just keep good communication skills. You should be, talented for the branch also, and you should not misguide the people. Believe me, patient is not a problem in India. I can tell you that after 6-7 months of dedicated, if you sit at one time and you leave at one time, your OPD predictable timing are there, and you attach yourself with the like some online platforms also, you start getting the and you guys are like like Gen Zs and all that. Now we're expecting you to take the lead. In fact, you can really bring the like more of AI into it and really make the practice roar actually. The one con I must tell you about ENT, that if you are a gross surgical person, that you want to open this and that and all that, that's only up to neck we do. And all medical colleges are not doing benign neck muscle also. Thyroid, parotid are falling into the hands of general surgeons. But if you work in Delhi, Mumbai, Hyderabad, bigger hospitals you are working, you will get your share of thyroid, parotid, and they will be also doing. Otherwise, ENT is about the ear surgery, which is microscopic. The nasal surgery is again endoscopic. Laryngeal surgery is again, more of endoscopic work only. But the fellowships have really now started taking shape. Ma'am, what are the main various, things students can do after doing the post-graduation if the SR-ship is not available?
So believe me, as you said, na, ophthalmology senior residency, somebody has to forget it in med schools. I myself, I was from UCMS. I did my MS from UCMS, and I struggled to get into senior residency. I gave almost 12 interviews.
Yeah.
Afterwards, I was waiting for a UCMS seat, which came out to be a result. Somehow I found that seat be in, and again, then when I got into UCMS, but it was a long. So forget residency, guys. I won't suggest you to opt for it if you're doing it from metro cities. If you teach your city, then of course, senior residency in a good reputed hospital. For that also you need to have a good patient load, isn't it? The patient load that you surgery is that time. So this is
So guys, I would now take you to some questions which are asked by the student who want to take ENT. Number one, Dr. Dhawan, am I eligible for doing the like super specialty MCH training after ENT? Yes, you are eligible. The good news is that if you are carved out to become the super specialist after doing MCH, are ENT people doing are eligible for fellowships? Yes. Which MCH I'm eligible for? With the NEET SS and all that, you are eligible for head and neck surgery, surgical oncology, neurosurgery, and the plastic surgery, which is actually the recent development. And you are getting a big chance that if you want to do ENT, you can specialize further by doing MCH with NEET SS or INSTD SS. I repeat, head and neck surgery, surgical oncology, then plastic and reconstructive surgery, and lastly, neurosurgery also. So this can be a gateway for a bigger thing for you, because maybe, everybody is not meant to stop at the MDMS level. They want to go to the MCH level. So now ENT people are eligible for all these fellowships actually. Now, what is the, the technical, I would say advancement going on in the ENT? If you get to do from a good hospital, followed by you choose to do a fellowship somewhere. For example, I have been going to multiple hospitals after my, down south, there is very lot of hospital doing wonderful work. In the 1 year fellowship, they will train you for maybe flaps, head and neck surgery, or maybe the phonosurgery, implant surgery. You can do 2 year fellowship also, and that's possibility. So let me divide the ENT into further branches. What are the possibilities? Number one, you can go for endoscopic sinus surgery and the advanced surgeries of nose. And it is going way beyond. And I know Shivani ma'am would agree with me. When DCR is discussed, we have a tough fight. From here we approach through nose, madam approach to the outside. So we are entering into this and that domain. And more. Okay, I give you one example. The best surgical approach for pituitary adenoma nowadays is ENT approach. Why? Because we are doing the endoscopic transnasal transphenoid hypophyseectomy. You can ask me, Rajiv, but in my hospital, I would be hardly seeing the FES. Okay, what, guys, MS is the gateway for multiple things. Only thing is, you should be aware. And if in 21st century, in this era, you say, I don't have the information, it's wrong. And there are second thing which people are doing aggressively is implantology. Now, the cochlear implant is a norm in the country. We are the leading country in Southeast Asia. A lot of implant being done in Chennai, in Bangalore, in Delhi, in Mumbai, in Pune, in whatnot cities. So, a lot of people are going into the implantology. That rather than doing SR-ship, as Madam really said, very nicely said, that SR-ship is a tough thing. Let us not go into that as an assessment tool, that how much this branch would be actually in demand in the general public. Because that becomes a little, because criteria for ENT or ophthalmology SRs is set by the government, and they keep limited numbers only, and there's a lot of fight over there. I agree, but that's not the exact yardstick to understand how much this demand, the branch can be sought out in the public. Now, the endoscopic sinus surgery, one, implantology, neurotology is coming as a separate specialty now. The medical neurotology, surgical neurotology, skull-based surgery is now getting separated. There is Dr. 𝗀𝗃𝗵𝗃 is there down south in Kerala, and he's doing exceptionally good work, and he invites people. You can work with him for 2-3 years. You can learn, and they're very liberal people to teach you. In Coimbatore, there are many institutes. Then we have got, in Chennai, many institutes are there. And they have got Madras ENT Research Foundation is there. Then there are CMC Vellore has got many fellowships. My ENT hospital, Hyderabad, got many fellowships over there. It's only that once you deep dive, don't stick to the departments only. Always in the second year onward, start going to conferences and workshop and start doing things of, you have to meet people. You have to meet the consultants over there. And, you have to make the bridges over there only. But one thing I tell you, that the variety of cases is pretty good here. Because from madam sinusitis to DNS to nasal polyp to nasal tumors to the, like endoscopically we're going to the orbit also, the skull base also we're going. And then the ear, like from the maryngoplasty, the mastodectomy, the STEPI surgery, and the implants now, cochlear implant, the bone anchored hearing aids, the middle ear implant like TORP and PORP, the laryngology, phonosurgery is a different ballgame altogether. Then, of course, benign neck masses, the thyroids and the parotids and etc. And of course, the degree name is the otorhinolaryngology and head and neck surgery. So that's why MCH head and neck oncology is being allowed to you. The training has got that mandate, but yes, I agree. All hospitals are not doing, every case. But, you can go expect yourself to be going to some other hospital for 6-month training, and you can take it from there. And if you do MSc ENT from India, you are a person who wants to go out, you can do MRC ENT from India. And it's not a very tough exam also. And you can, try your luck in the Europe as well, mainly of course UK and some other countries also, against that. But the main con will be, I'm telling you, little bit, you can say dermatology, like, it's like, you can say easy to establish practice. Here it will be a little slow, but once you stabilize your practice and you start working with passion, patient would not be a problem for you. But ask yourself, what is your heart saying? That is this branch, 1 or 3 branches which you thought that you would be doing in the future? Over to Shivani, ma'am.
Yeah. So before I start about ophthalmology, sir, I would like to say something. Like, if you are thinking about only the senior residency thing, it is the same with derma, with radiology also. With some leading branching also, guys, it is not mandatory that you will be settling down very easily in metros for senior residency in good colleges. It is very, very difficult. Even in dermatology, even in radiology, we used to get only 1 seat and almost 30 candidates come for the interview. I'm telling you, because I have given almost 12 interviews. So that's why I have a lot of experience. And finally, after I did senior residency from UCMS, I just thought of skipping being an assistant professor there. I just forgot. I couldn't think of working 9 to 5 p.m. I just forgot that I would not be able to do that. Is not my domain. So senior residency thing in Delhi is a big, big, big job. Sir, again, the second point you told about some other people taking up our cases. This happens in dermatology also, guys. It is not easy to establish a private practice because we have cosmetology clinics. All the second parlors, which is near to your clinic, is eating up your cases. They are providing all those cosmetic things. Even if you think about the hair transplantation thing, the local salons are giving you, they are offering you all the hair transplantation techniques and things in a much cheaper rate. So it is very, very difficult to settle down a private practice in dermatology also, bachas. So you have to think about it. If you are thinking about taking dermatology, if you're getting good ranks, please ensure that settling down with a clinic is not very easy. Now, if I have to talk about ophthalmology, first of all, I would like to say it's a lovely branch to be in because it gives you an immense satisfaction because you are giving vision to someone. You are operating a patient and you give vision to someone. That is a special sense. So, it is a very, very satisfying branch, first of all. No matter how bad your day was, but you get up and you see into somebody's eye and a thankful eye. So it gives you a lot of happiness and you feel that you are a doctor, right? Now, if you think about it's purely a surgical branch, no, it's not like that. But if you are thinking about getting a lot of money, beta, you can't get money from your OPDs. Okay, OPD is refraction, your diagnostic ophthalmology will give you a good amount of money to settle down. But if you are aiming about the milking thing, it comes with surgeries and then there is no limit to earn. The money is limitless, but you have to be master in your skills. You have to be doing good surgeries. Bread and butter is definitely cataract. But again, you have to be very, very good in getting your patients, getting your patients for surgeries, isn't it? Like as sir mentioned, once a patient comes to you, it has to be your patient. Don't misguide them. Like sir said, if you are good, if you are humble to them, if you know your skills well, your patient is with you. Okay. Now, the third important pro for ophthalmology, I would say, is that we hardly have, emergencies. We don't have night duties. We don't have night shifts. Nobody would bother you at 12 a.m. that I have a problem in eye and I have to see you immediately. Like, see, look, what happens with me. So I am settled in a private practice for almost 12 years. I have my clinic just on the walking distance. So if I get a patient, I'm not bothered to see that patient right now. I'm waiting. My assistant is there who would like to examine the patient very quickly, who will take the vision, put some drops, and I'll go to see the patient after 1 hour. I'm happily doing it. I have no one to challenge me. Why are you not there? Okay, but this cannot go with the rest of the branches. So otherwise, this is a very cool branch. I've never seen a practicing ophthalmology sulking. We are very happy people, very cool, very chill, relaxed people. Sir must be knowing, ma'am is also an ophthalmologist. So he must be knowing how the work-life balance is exactly.
I totally agree.
So the work-life balance is appropriate, guys. I am doing everything. We are following everything. It gives me, a lot of time to manage with my teaching, with my classes and my learning. Even I am a student, so I keep on learning. I keep on reading a lot during my clinics also. So the next pro, I would say that it is not purely an end branch. I mean, you don't have to be in a rat race for another NEET SS, but it gives you an exposure of a lot of subspecialties. Like we have almost 9 subspecialties in Ophthal also. We have retina specialist, glaucoma specialist, pediatric specialist, queen specialist. Like if I don't want to see a child, I can't examine a child, I can't do refraction in the child. So I just refer that to my pediatric squint specialist friend. So he'll be doing that. Okay, so we have a connectivity. We have so many people connected to us. Like I am a cataract surgeon. I do cataract surgeries. I am still learning refractive surgery. So there's a lot of scope, lots of exposure with ophthalmology. Okay. Now, beta, it's, it gives you immense satisfaction when you see a patient right from the diagnosing thing, looking into the fundus, the retina checkup, glaucoma diagnosis. And, we have a lot of things in diagnostic also. I have done my fellowship in medical retina. So I diagnose so many retinal pathologies with the help of the good investigation procedures that we have. We don't have trained technicians for that. I do my investigations myself. I diagnose them myself. So, that diagnostic part is also with me now. Apart from OPD, apart from surgeries, there's a lot of diagnostic things coming up in Ophthal also. And like sir said, saturation, है ना, ये saturation मुझसे भी sir बहुत पूछते हैं. So I say, what if I have 3 ophthalmologists nearby me? I'm happy, it's okay. मिठाई की दुकान सर जब होती है तो मिठाई की दुकान भी लगातार ही होती है ना? So if you are good, you will be selling your product, isn't it? And believe me, none of the ophthalmologists, no doctor, I would say, no doctor in India is sitting idle. सब पैसे कमा रहे हैं, बहुत अच्छे पैसे कमा रहे हैं, and we are happily living a life, isn't it, sir? So everybody is earning because, and ophthalmology especially, बच्चे, I would say कि cataract तो सभी को होना है, and cataract 2 बार होता है. We have 2 eyes. So cataract occurs to everyone. And refractive surgeries are in boom, isn't it? This is such a booming thing because, thanks to COVID, thanks to the online classes, thanks to the screen, thanks to the phone. So everybody has glasses. Everybody wants to get rid of refractive errors. So refractive surgeries में इतना evolution है. We have robotics, robotic surgeries आ गए हैं. So, it is just that you have to keep this in mind that if you want to do surgeries in your life, if you're bent to do surgeries, then only you should take up these 2 branches. ऐसा नहीं कि आपको जो मैं OPD करके पैसे कमा लूंगा, नहीं बच्चा, which was my fault also. Actually, at one point of time, I would be like, it's not my forte. So it would be disastrous, bacha, if you are confused about medical branch and a surgical branch. Okay, if you are aiming to do a surgery, having a good work-life balance, having a very good amount of money, and you want a peaceful life, isn't it? What we want at the end of the day, यही चाहिए ना? कि एक peaceful life हो, पैसा कमाओ, खुश रहो, बच्चे बनाओ, खिलाओ, सब कुछ करो. So that is what you can get with these 2 branches, beta, है ना? So you have a lot of fellowship offers. At my time when I did my PG, we didn't have a lot of exposure. We didn't have those fellowship options. Okay, only few institutes were offering fellowship, but nowadays there are almost 50 institutes, more than 50 institutes which are offering fellowships. We have short-term fellowships, we have long-term fellowships. Forget about doing senior residency. PG karo, सीखो. Jitna सीख सकते हो, सीखो. You have to struggle maybe in your first year. First year PG residency could be a little challenging. Everything you find will be chaotic, okay? Because आपको इतना आदत नहीं होता ना, you just work like a multi-purpose worker. आपको patient को पकड़कर भी लेके जाना होगा, आपको clean भी करना होगा, है ना? And you have to give your cases to your seniors, right? So first year of residency may be a little troublesome for you, but gradually the moment you get to learn the surgeries, you will really, really enjoy the subject. You'll have the feel that you can do things from microscopic. I say that anyone who drives well, he can do a cataract surgery beautifully. Okay? There may be a learning curve, but it's okay. Learning curve is for everything. Driving thoda na aap bachpan mein seekh ke aate ho. You learn driving, you have, you take your own time. Like I have been driving for last 15 years now. I'm not saying that I can drive blindly, but I can drive like almost blind. So same goes with cataract surgery. You should have a hand-eye coordination. You should be good with your foot pedal, right? Catching patients is more important. So I would say if you are a good person, a humble person, you will definitely be a good doctor. Your practice will be roaring, right? So ophthalmology is a beautiful branch to be in, no doubts about that. I'm very happy, very satisfying branch, and whatever your queries are, you can ask me now. So
Wonderful, ma'am.
DNP or MS, this is also one question which, because students are thinking like going to a periphery or a B tier or C tier city, taking up this specialty in a government college from a peripheral place or a DNB from a better place. What do you suggest them?
I always say that if your aim is not a government job and you don't want to see yourself as a teaching specialist and all that, and if you are carved out that ultimately you will be settling down into private practice, I would prefer DNB from a good private setup rather than from a peripheral medical college, because the type of exposure you get. For example, you are doing ENT from Gangaram Hospital in Delhi. It's a DNB seat over there. The variety of cases they are doing is pretty diverse, and you get exposed to that. There is a some amount of percentage of cases they're doing free, so that you get hands-on also. And passing rate of the institute is also definitely good. And similarly for other hospitals also, rather than going to a very distant, remote place from far from your home, and you are from Delhi NCR, you can stay. Similarly, from Mumbai, lot of institutes are there who are doing good DNB and down south also. But yes, do your homework. Yes, the few criteria. Number one is the type of cases they're doing. Number two, the amount of work they give to second year and third year PGs. And the third one is that teaching academics are like there, and the last 3 years passing rate. So just see that, and if that is all moderately okay, I think choose that over the peripheral medical college masters. It would not really be a good idea until unless you're hell-bent that I want to become a teaching specialist in medical college, which actually I think things are changing now. Ma'am, I would like to add upon a couple of things, that in a lot of my, colleagues, they have diversified into, they have not done any MCH or something, but they have diversified completely into the plastic surgery. Like rhinoplasty, everybody wants to have a perfect nose. And, because thanks to Snapchat culture, people are obsessed with their, this thing. And the quantum of the patient is very high, and people get the fellowships, short-term fellowship in the rhinoplasty, and they do it from like some unknown medical colleges, but they start making their baby steps toward this fellowship in the second year, third year, and they start writing to people. They make some publication in that regard, and then they eventually end up working those people and come back and start working in a more like a specialized field actually. So in ENT, the the quantum of OPD plus procedure is very significant. As compared to ophthalmology, just as ma'am told that, we have got a lot of, like OPD clientele, like ear discharge or, sinusoid. Every patient does not go for surgery in that case. And similarly, we have got many endoscopies. For example, what is the procedure we do in the OPD? One is diagnostic nasal endoscopy, which is almost there in every case we have to do. That is separate procedure actually, apart from the OPD actually. Number two, you have to do the fiber optic laryngoscopy. And number three, we have to do the lot of audiological investigation. People have got in-house audiologist, and audiology is such a vast science altogether. And you can, like have your audiologist coming to your clinic for 1 or 2 days in a week, and you pull the patient for him on that day, like pyoton audiometry, tympanometry, the stability reflex, or brainstem evoked response audiometry, total acoustic emission, and whatnot actually. And one of the field which is hidden, which people, like Bombay people are focusing big time, is sleep. Now, sleep apnea, because of the lifestyle we're having, and the type of diet actually, and the sedentary habits, like more or less we are very, very happy with. The sleep apnea issue are increasing actually. And one of the major reason of sleep apnea is the, ENT area issue. Maybe. And this sleep apnea, the medical management, the CPAP, and that surgeries also, the palatal and they are actually becoming a specialized thing. What I'm trying to tell you, that ENT can become one of the platform where you can shoot to very specialized work without having the need of doing the MCH also. The
Of
only
course.
thing is that people should be aware. People do not like do the homework in second year, and they think that once I'm done third year I'll try ऐसा शिप कुछ अगर मैं कुछ नहीं मिलेगा फिर मैं ये ऐसा नहीं होता. Secondly, onward, you go to the fellow, you become members of the respective organization. For example, there's a phonosurgery, association, become member of that. There is a Indian Society of Otology, become member of that. And, wherever you are going, you start making your, inroads into those professors, those private medical consultants also. And one fine day, you write an email to them. There is a sort of, like a familiarity quotient over there. They generally say yes, okay, you can come over for 6 months and work with us. And that can be like, for example, like adenoidectomy used to be a crude way, curettage. I used to hate that surgery actually. It's a blind surgery. You put a curette like that blindly, you go to that area and just scoop it out. Now, if you see the coblation, now the coblation adenoidectomy is almost bloodless surgery. Similarly, for tonsillectomy, also using coblation. So things are changing big time. So to summarize now everything, number one, if
Excuse
you're
me,
not
sorry.
passionate,
We have a
yeah.
question from a student, sir. Sir, he wants to ask us that is it worth taking MS Ortho or MS ENT from a deemed university, or he should give it a drop again? So what about
It,
deemed university, sir?
it is depending on your financial appetite actually of your family. Now, how much? Because see, if you have got the financial backup and you can utilize that, I would say don't let the rank go from your hand. Invest this year towards that, because everybody is differently blessed actually. So if your blessing is toward that side, your family can support you without having to take too much loan and all that. I think this is okay. You can
Not a bad option, of course. Not a
yeah,
bad
yeah,
option.
not a
Right.
bad option. You can really go over there and start learning orthopedics, and start to really then do hand fellowship of Singapore actually. Please think about that. Like you are from DY Patil, you did that, and then you went to Singapore for a shoulder fellowship. That become a very good. Then you are working in the best of the hospital like Narayanas and all that. Then that's a very good life you're looking at, and nobody in the shoulder would call you for emergency. Your shoulder is very planned surgery. Like hardly dislocation, you're not called. Don't worry about that. You will be called for very premium surgery. Guys, we have to look beyond the usuals now. In this 21st century, with the IT things available, with the AI now dominating the scene,
Coming up.
it's actually changing. You don't have to restrict yourself the way your seniors may have been. Because the problem is when we look at the career, we look at the professors, we look at the medical colleges. And sometimes that's not a very nice impression about the branch, actually. And we think that we don't work on that. But look around, madam. I will say, if you have time, just now, after filling the branches, also roam around everywhere, see in the corporate, sit in the
Okay.
cafeteria of the corporate hospitals, actually. Sit in the cafeteria, see who are the people. Like, are ENT people called at night? Because there's a question, huh? See, guys, you can pick and choose your practice, you know what? Like, we are traveling a lot, we are teaching and all that. And not, my friends who are not teaching even, they have opted out of this thing, that they are not supposed to be called at night. So there are JCs over there, junior consultants, or someone who will be taking at a certain level, you can really say, no, I'm not going to be foreign body knows now. Please don't bother me. Until the foreign body bronchus and is very tough one, then I can really be called. Like, so in the initial years, everybody is different. But then you can pick and choose. But you know what? If you're a general surgeon and if it's appendicitis, it's 1 o'clock, you will have to go. Sinusitis patient will not die, but appendicitis patient will die by the morning. So that is what, like, I cannot imagine myself doing ops gynae because there's a lot of commitment in ops gynae. DGO, for example, diploma. So MSc ENT versus diploma ops gynae. I'm saying that. Guys, please understand that, everybody's not carved out for that kind of commitment. Because if I show you my wife in the first trimester, I would want you to be there on the day of delivery. My child's EDOD is plus minus 7 days. So that calls for a huge commitment, and don't betray your genetic code because there is a genetic programming within you. And I know, but sometimes rank is not that great and we can't bargain that well, but try to have the best bargain out of it. I remember one of my friends got a good rank and he said, मुझे patient अच्छे नहीं लगते. मुझे patient देख के ना घबराहट होती है. And ultimately, he said, I will be happy doing pathology. I don't want to see the patients. At least he was truthful to himself. Then he did pathology from a good college. Then he did onco from Tata Memorial. And he is a wonderful oncopathologist and he's a happy individual. As ma'am said, what is the goal of everything? No philosophy. Everybody, be it doctor or anyone, क्या चाहते क्यों? यही चाहते ना कि भाई लाइफ अच्छी हो, पैसा हो, फाइनेंशियल इंडिपेंडेंस हो, घूमना फिरना हो और अपने पास अच्छा घर गाड़ी हो और अपने को टेंशन ना हो, ये जरूरत पड़ेगी. That is possible in medicine. But only thing is कि the way to earn that money should be in sync with your mindset as much as possible. We do understand we never get a first branch, second branch, third branch sometimes, but whatever branch you have three in your mind, you can really decide that. But as far as ENT and ophthalmology are concerned, I can tell you the work-life balance is pretty good, I would say. You can organize your practice because my wife is an ophthalmologist. I know that from that angle too. I'm a very good friend and very good colleague also. We know that there is a work-life balance is possible for sure. And if you're a person who's very fond of OPD patients, ENT will give you enough number of patients. Don't worry. Sinusitis, earache, ear discharge, hearing loss. I did not talk about hearing aids. Hearing aid is another domain actually. As Madam said, a lot of people get cataracts. A lot of people get pressed by QCs also. No? They want to get a good counseling. But only humble suggestion to all of you is please be honest toward the patient. You have to earn money, but process of earning money should also be happiness for you. That's what the take is. Ma'am, any other question we are missing?
Not really, sir.
All
They're
okay.
asking about, how's the residency? So in ophthalmology, as I mentioned, the first year, you may not enjoy it because you have to do a lot of work, which, we are not habitual of. Everywhere, the first year residency is not so good. But as you turn towards your, second year, you'll be happy because you will be having your juniors where the groundwork can be done by them. You'll not be only filling the notes. You'll not be only looking at the patients post-operatively. You will get to do your patients and you will be looking to your post-operative patients. So that gives you an immense happiness. Your learning will be good. You have to get a lot of exposure for that also. So first year, guys, you may not be very happy in any branch, I would say. But if you have selected a branch of your choice, but remember my words, your choice. So if you are in a field, what you want to do, you will not be sad at least. You'll be happily doing it. Whatever work is given to you, you'll be happily doing it. So guys, don't compromise with your branch. That is what I want to do. Don't compromise with your branch. If you're bent to do surgery, if you think your hands are surgical hands, then only take up a surgical branch, bacha, because otherwise, this is something which is going to be with your entire life. You can't change that. Otherwise, even if you want to do, like I have a friend who has done anesthesia, MS anesthesia. She couldn't handle anything. She just left after 2.5 years, rested at home for 3 years. She got married and then she did a cosmetology course in Derma in Chandigarh. And now she has a roaring practice. She is doing all sort of cosmetology things. And, she has invested a lot, definitely, but she is now earning good and she's very happily doing everything. So if you want to take up surgery, having a good, cool life, earning a good amount of money, no night duties, no emergencies, nothing of that sort, you can go for ophthalmology and ENT both. This is the crux of anything. you have anything to ask us, you can really ping us, and we are there to help you. Okay.
You can ping on Instagram also on our respective profiles, and you can leave a message there. We'll be
Any
happy to reply.
advice you have for any other field, doc tutorials are there with you. All the faculties are very helpful. Guys, you can ping us, you can write to us at Instagram or doc tutorials platform. We'll be happily helping you. We'll be sharing our experiences, how the life is, because we all are, working. We all are specialists in our fields, and we are handling our OPDs, we are handling our OTs as well. So we are all practicing doctors, settle down very well. So you can ask us any query related to the subject. So thank you very much, sir. We will wrap up the session now. Best of luck to every student who is gonna appear for the counseling. May you be very good doctors, because I'm sure that you are very good human beings. So all the best. May you all get your dream branch and you live happily after that.
Thank you very much, ma'am, for organizing. Thanks. Thank you.
Thank you very much, sir. Thank you.
Bye.